Welcome to Wilderness First Aid. This is an online PowerPoint on assessment, patient assessment, and we're going to go over these slides and then there'll be an associated quiz with it. So let's get started. So we want to take a quick moment to look at the scene when we get the chance. So when we're done with this lesson, we'll be able to note the importance of immediately establishing scene control, understanding the definition or the mechanism of injury, or the nature of the illness, and why those are important factors, and how to assess the number of victims and the need for additional resources. So often emergency situations are unsafe. There's a reason why these people had their accidents. So you yourself need to be careful so that you don't become a victim yourself. Your safety is the highest priority, even before the safety of the ill or injured person. They're already having a bad day. No sense joining them. So look for obvious hazards. Think of, what in the scene what could go wrong. Limbs, like widowmakers falling, lightning strikes, whatever the situation warrants. High water. If it's unsafe, don't approach. Just get notification out to somebody as soon as possible about what's going on and get yourself into a safe situation. So you want to protect yourself from exposure to infectious diseases by using protective barriers. That's your safety glasses, your medical gloves, and sometimes maybe even the use of a mask. So get a general impression of what's going on. So that will give you clues as to what's happening. So if you see take in the whole scene and see what's happening. Emergency situations are unexpected events and can initially be confusing. So you got to take a moment, breathe, and sort out what you think is happening in the scene. You're going to form a quick impression. You want to know where the person's located, how's the body positioned, do they look sick or injured, is the person's body deformed or bleeding, is there anything nearby that could be involved, so animals, food, medications, whatever it might be. Identify the number of people that are affected. So how many subjects are we looking at? Is it 1? Is it 5? We don't know. Or we need to know. If circumstances indicate the need for additional resources, pass that on to the responding rescue personnel. So when you get in contact with them, you need to let them know what you've got going on. Injuries occur due to physical force against the body. The manner in which that force creates an injury is called the mechanism of injury. Essentially, the mechanism of injury is what happened physically to cause them to be injured. So mechanisms of transfer significant force are best assumed to result in serious injury. A fall from a height of over 3 feet, compression of the head into the neck, a significant blow to the body, penetration to the body by sharp objects, or severe deceleration while being restrained. So that would be like a car seat scenario, or climbing harness, and they fall, but the rope and the harness stopped them. There's still going to be some mechanism of injury there. So a significant MOI, will help you quickly determine the possibility of a spinal cord injury or internal bleeding, which is best treated early. Nature of illness. So similar to the MOI, the NOI, the nature of illness, is the medical condition you suspect may be affecting the person based on your general impression. So you're looking at the scene and you're trying to determine, why is this person sick? So they could have difficulty moving, confusion, difficulty breathing, indication of pain. Forming a suspicion about an MOI or an NOI can quickly identify an emergency situation and guide the rest of your assessment and care. One of the most difficult decisions to make is whether or not to get involved. So it's a tough situation, but if we can get involved, if we make the decision to get involved, then we need to be prepared to act. It's normal to hesitate, and to be unsure about your ability. But if you don't help, who will? So you might feel like the problem's too big for you to handle alone. You're only the first link in a progressive chain of care, so there will be other help coming. Your involvement lasts only until relieved by another provider or responding rescue personnel. You're not alone. So you might be afraid of making things worse. You're going through training. You've got skills. You need to be able to use them. You might think that you don't have a lot of medical knowledge, but in fact you do. The course you're taking now, Basic First Aid, gives you a lot of skills that other people don't have. So emergency situations can quickly become confusing. So and they can change. So the situation might be stable one moment and then not stable the next. So you need to be able to control the situation, and things can get emotionally charged, and that can increase the risk of harm, not only to the subject but to you yourself. So people identified in leadership positions need to take charge and stay in control until the situation becomes safe. So that means that, if you take control, if you decide to help and you take control of this person in this scene, then you need to let other people know what their expectations are, and or what your expectations for them are, and how they can help you. So when traveling in a group, you can establish leadership roles ahead of time. So just like with ESAR, when we have our TL, our medic, our navigator, our equipment people, you can do that even when you're just hiking. So the two things that a leader should have in these situations is competence and confidence. And those are two very different things. Competence is the ability to is knowing what to do and being being good at it. Confidence is having the character to just go forward and do it. You can have confidence without competence, so you need to be careful of that. Competence or the adequate ability to perform can be gained through training and practice. Confidence is a feeling of being certain of your ability to act in a proper way. A leader with confidence appears steady and capable. So what's the highest priority in an emergency scene? Your safety. Your safety, your safety, your safety. The initial assessment helps a first aid provider quickly identify immediate life-threatening problems. So after completing this lesson, you should be able to state or identify the following: the purpose of an initial assessment. So before you can provide first aid care to an ill or injured person, you must first identify the things that are creating the difficulty or harm. This is done through an organized step-by-step assessment process used in every situation. Using a combination of initial and focused assessment, this process identifies immediate threats to life and prioritizes treatment and provides a detailed method for identifying less serious problems. So the goal of an initial assessment is to quickly identify an immediate immediate threats to life, and to provide the indicated life-supporting care without delay. So your very first priority is, what are the things that are going to kill them right now? So the initial assessment steps can be easily remembered as ABCDE: airway, breathing, circulation, disability, and environment. Those should all be very familiar to you. Immediate activation of professional medical help and a rapid evacuation to an advanced medical care advanced medical care is essential for any life-threatening conditions. So the sooner you're able to get word out, the better. So you gotta find out if the person is responsive in any manner. It could be obvious or require your verbal and physical interaction or prompt. So if you're unsure, determine the responsiveness by tapping or squeezing the shoulder and asking loudly, "Are you all right?" A person who's unresponsive requires treatment learned in a CPR training course, because you're going to be working on airway, and so you're going to need to be doing rescue breaths and cardiopulmonary resuscitation. If responsive, introduce yourself, indicate your level of training, and ask if it's okay to help. "Hi, my name is Mike. I'm trained in Wilderness First Aid. Can I help you?" If a person consents to your help, ask an open-ended question about the situation, such as, "What happened?" Because the focus is to identify life-threatening issues, the answer is less important than forcing a response that enables you to identify any serious problems with the airway. If they can talk to you, they can breathe. Gauge the level of responsiveness. A diminished level of responsiveness can lead to a blocked airway due to relaxation of the tongue. If semi-conscious, consider placing the person in the recovery position to maintain and protect the airway. Look for such things as gum, tobacco, blood, or vomit. Listen for sounds such as gurgling or wheezing. Those are things in the airway. Log roll the person to drain fluids from the mouth. Sweep the mouth to remove solid or semi-solid matter. All right, quickly form an impression of whether or not breathing is adequate. So you want to look for either regular, even, and effortless. Inadequate might be too fast, too slow, shallow, labored, irregular, or gasping. If breathing appears inadequate, look for an injury to the chest. Consider the use of supplemental rescue breaths to assist inadequate breathing. So, you can use those rescue breaths even on a conscious person. Scan the body for signs of severe bleeding, such as spurting wounds, large blood stains, or pooling blood. If significant bleeding is found, immediately expose the wound and attempt to control the bleeding. Look for progressive signs of impending shock. So check the radial pulse. That's a quick measure of adequate blood pressure. Check the skin for tissue color, temperature, and moisture. Pale, cool, and clammy skin is an indication of shock. You don't want them to go into shock. If you suspect shock, make sure other primary treatments, such as the control of bleeding, are being effectively provided. If you suspect a spine injury, immediately place a hand gently on the person's forehead and ask them to stay still. Putting your hand on their forehead While it doesn't do much, it does allow them, it gives them the sense that you're in charge, you're in control. If another provider is available, have that person manually establish spine motion restriction as soon as possible. If the environment conditions create a serious burden or risk to the ability of a person to survive, change the conditions quickly. Meaning, get them in a shelter. Get them down off the mountain. Get them out away from where lightning might strike. Move the person to a more protected area. If you can't move the person, protect him or her from conditions as best you can. If problems are hidden by clothing or the position of the person, quickly expose the affected area and take a look. That means you need to be able to open up clothing, and you need to be able to, whether you're unbuttoning, unzipping, or cutting, you need to be able to get to the skin to be able to see what's going on. In many cases, the initial assessment only takes a few seconds, and when there's no obvious life-threatening problems. Stay focused on looking for life-threatening issues. Highly visual, moderate, and minor things can draw your attention away. So you want to stay focused. Because things change, and so what might not have been a life-threatening thing may become a life-threatening thing. So you want to be aware when things change. If a life-threatening condition is present, immediately activate the process for getting help. You probably want to do that. You want to do that in most cases that are going to be represented in this class. Airway. Check for a response, tap, shout, squeeze the shoulder, and ask loudly, "Are you all right?" If unresponsive, have someone activate professional medical help, and if available, get an AED. All right, so position the person face up on a firm, flat surface, like the ground, like a pad. Look at the face and chest for normal breathing. Take no longer than 10 seconds, and if you're unsure, assume breathing is not normal. Weak, irregular gasping, snorting, or gurgling is not normal breathing. So if you experience any of that, then you have a breathing problem. Provide immediate care. So you're going to do your chest compressions, and hopefully, if you've got an AED present, it's on its way, and it will instruct you on what to do. So if the person's not breathing or only gasping, perform CPR beginning with compressions. It's at 30 to 1. Apply an AED as soon as it's possible. If normal breathing is found, place an uninjured person in the recovery position. Resume initial assessment only if circumstances allow. Okay, so here they're just recapping. So you do your initial assessment, you're tapping and you're shouting, or you're tapping and calling out to them, "Are you all right?" You place them flat on their back, face up, on a firm surface, and then you're going to provide chest compressions and rescue breaths unless they regain their ability to breathe. All right, so airway. Introduce yourself, indicate your level of training, check for diminished level of responsiveness, look and listen for airway issues, consider recovery position, drain fluids and sweep solids from the mouth if found. Quickly assess adequate breathing. If inadequate, consider the use of supplemental rescue breaths. So you may not have to do chest compressions for this guy, you may just need to do rescue breaths. Scan the body for heavy bleeding. If found, control it immediately. Check the skin signs. Look face for skin color. Depending on the skin tone, it may be easier to check tissue on the palms, fingernails, inside eyelids, or inside the lip. Touch the person's forehead with your bare wrist to assess skin temperature. Note whether the skin was wet or dry. If shock is suspected, treat for it. All right, consider disability, consider the mechanism of injury. Does that make you suspicious of a spine injury? If so, initiate spinal motion restriction. Okay, if environment. Consider if the environment conditions will impact survival. If so, move person or protect from extreme elements. So out in the woods where we would be, it would be good for you to get them off the ground if you can. Put them on a pad, on a tarp and a pad. Get a sleeping bag around them and help keep them as warm as possible. All right, so here they're just recapping. She's in step one. She's introducing herself, asking if she can help, and she's checking the airway, getting that open-ended response from him. Then we move to step two, breathing. She's looking and listening for how he's breathing. Step three, we're looking for circulation issues, so bleeding. If we suspect a spine injury, then we're going to immobilize the spine through the head and neck, and we're going to protect from the environment, which in almost every case here in the Northwest, we're going to want to get them off the ground on a tarp, on a pad, with a sleeping bag or something around them. Okay. The initial assessment steps are easily remembered by using A, B, C, D, E. What are the 5 steps? Airway, breathing, circulation, disability, and environment. Okay, so now we're going to look at the secondary assessment. So this will help provide information about hidden or confusing medical problems. So after completing this lesson, you should be able to state the following: the importance of a chief complaint, the purpose of a focused assessment, the importance of a hands-on physical exam, the importance of taking a history and about how to do so, the importance of vital signs and how they can change over time. So here we go. After completing this lesson, you should be able to also correctly demonstrate how to document in written and verbal form using information gathered via SOAP format, which is not a format that we use with ESAR, but it's good to know it. A physical exam on a person, how to take a set of vital signs, and how to take a sample history. After you complete, so the chief complaint. Ask the person about what happened and how he or she is feeling. If the person has diminished level of responsiveness, ask bystanders. So find out from other people what happened. So you're going to do a physical exam, look and feel for unusual physical signs. This is dots, you know that mnemonic. Deformities, open wounds, tenderness, and swelling. Then you're going to do your sample history, signs or symptoms, allergies, medications, past medical history, last input, output, events leading up to the current situation. If the person has a diminished level of responsiveness, ask the bystanders if they know any of that information. Okay, vital signs. Measure the person's vital signs. So we want to know their level of consciousness. Are they alert or are they alert and oriented? Are they, what is their ANO? The easiest way to do that is just kind of look, if they can answer who, what, when, where, and why. They're probably in an ANO 4. If they're slurring and they're conscious but they're slurring and they're not making sense, they're at like a level 3. If they're if they're not responsive except through like vigorous shaking, pinching, that sort of thing. Like if they moan when you pinch, then that would be a level 2. And level 1 would be they're completely unconscious and non-responsive. So you want to check their pulse, you want to check their respirations and their skin signs, which is SCTM, skin color, temperature, and moisture. All right, so here she's in step 1. She's introducing herself, or not introduced herself, but she's talking about the chief complaint because she's already introduced herself and when she ruled out the A, B, C, D, E. So then step 2, she has him lie back and she's doing a head to toe physical exam. There she is checking his shoulders out. And then step 3, they're doing a sample history. So that's symptoms, allergies, medications, prior medical history, last in, last out, and the event. And then vital signs. So they're taking a pulse, looking at the respirations, and looking at the skin color, temperature, and whether it's moist or dry. Open-ended questions such as what happened can help establish the chief complaint. So we know that already. It can provide a starting point. So obviously if she says my knee's hurting, then that would be a, that we know that there's an injury there. You're still going to go through the whole rest of your assessment though. Don't skip the rest of it just and go straight to the knee, because there might be bigger things going on and she might not be aware of that, or he might not be aware of that. So you can ask them what they think the problem is, even if it seems obvious. This may reveal a problem more pressing, like cognitively. If they're not, if they are confused and dazed and can't figure out whether it's their right foot or their left foot that hurts, that might be an indication of something else going on. If they have a diminished level of responsiveness, ask bystanders about what happened. Okay. You want to document your assessment findings because you're going to want to be able to hand that stuff off to the professional medical providers when they get there. Documentation, and it also allows you to track and see trends. So if you don't document, you might not catch that the pulse is getting rapid. So just make sure you note those things. Pre-established medical care report form designed to be complementary to your assessment process can be an important addition to your first aid kit. That's your SOAP notes. If possible, have another provider record the information while you perform the assessment. That way you're not stopping and writing. All right, so SOAP notes. So here's what, so the mnemonic device SOAP can help you record and organize your documents in a manner that will make it more understandable to others. So, subject information, that's the S. O is objective information. A is assessment information. P is a plan. What are you going to do with them? All right, so subjective information. So you want to know things like name, age, address, physical description of the person, what happened, what are they complaining of, and your sample history. Objective information. So physical exam findings. So this is what you found. So maybe not only did you find that he twisted his ankle, but he sprained his wrist as well. So you're going to mark the head as clear. You might mark the head as clear, the neck is clear, shoulders clear. So it goes down the list. It also could help you to remember what what you need to do. So, and then it's also going to be the vital signs. So these are the things that you are observing. Okay, so assessment, describe what you suspect is going on with the person. So you've done your exam and you have an idea of what it is that you think you need to treat. So you're documenting that. Describe any problems developing over time. So as things change, then you're adding that into your notes. And then describe the short-term treatment plans. Describe your evacuation decision and describe any extended treatment provided due to delayed in evacuation. So if you can't move them out, you got to keep the plan going. All right, so here they've broken it down into 4 parts here: the medical care report form, the objective information, the assessment, and the plan. Those should be fairly simple. Okay, so we'll do a documentation exercise on the Sunday. You're going to fill out the form as completely as you can. There's the story. Okay, so your hands-on physical exam. In checking the person's body in a head-to-toe manner, looking for indications of illness or injury. So you're going to use dots to remind you what to look for: deformities, open wounds, tenderness, and swelling. Explain you are going to perform a hands-on physical exam and ask for permission. So every step of the way, when you're going to do something, you want to ask them if it's okay. All right. As you move down the body, apply gentle, firm pressure with your hands. Everywhere you touch, ask the person if it hurts. Look for a reaction to pain. The human body is symmetrical. Use side-to-side comparisons to identify abnormalities. So, for example, check the right shoulder to check to see if the left shoulder might be swollen. If clothes are hiding an injury, remove or cut away to get a better look. With the head, inspect the hair and scalp, look for blood on your gloves, check the ears and eyes and nose, inspect the mouth, teeth, and jaw, check for unusual odors and breathing sounds. With the neck, feel sides and back of the neck, look for stoma, check for medical alert necklaces. Shoulders and chest, press shoulders together slightly. You can feel the collarbone. Press both sides of the rib cage while the person takes a breath. Inspect the chest wall. Now you're going to check the abdomen and the pelvis. You're going to press down on the 4 quadrants of the abdomen. Place a hand on each hip and press inward. Inspect for incontinence and priapsism. So now you're going to check the extremities. So feel the full length of each leg, front and back. Check each foot for movement and sensation. Perform the same examination on the arms. So then you're going to log roll the person carefully and inspect the back. So you're going to have to lift up the shirt to check the back, but you're looking for deformities, you're looking for blood, and you're only going to do this if you don't suspect a neck injury. All right, so here they just go through the steps that we just went through. Vital signs. They're not going to tell you what's wrong, but they'll give you an indication of how the person's doing. So, changes in the vital sign could indicate that the person's improving or getting worse, and so we want to pay attention to that. This can be valuable information, and so you see her there. She's checking her pulse. She's using her phone as a timer. So, level of responsiveness. is an assessment of how well the brain is functioning. So, alert and openly responsive, responsive to verbal stimuli, responsive only to physical stimuli, and unresponsive. So going back to what I said before, so an ANO4, alert and oriented, is alert and openly responsive. ANO3, they're responsive to verbal stimuli, but they're not necessarily making sense. They're not alert. Responsive only to physical stimuli, that's level 2, that's the shaking, pinching, and then level 1 is unresponsive to any stimuli at all. Okay, if someone is alert, it can be helpful to determine how oriented she is. There are 4 basic questions. What is your name? Do you know where you are? Do you know what today's date is? Do you know what happened to you? Orientation is commonly described as using the number of correct answers given. So when you say ANO4, you're saying that they answered all of those questions correctly. All right, pulse. The pulse rate and quality will give you an indication of how the person's circulatory system is functioning. The pulse rate is determined by feeling for a pulse either at the carotid or the radial pulse on the wrist. Count for 15 seconds and then multiply that number by 4 to get a per minute rate. So the radial pulse is the preferable pulse to use. Check the carotid pulse in the neck if you're unable to find a radial pulse. An adult's pulse rate is typically between 60 and 100 beats per minute. Very high or low rates can indicate potential problems. Also note the quality of the pulse. A pulse may be described as weak or strong, regular or irregular. Respirations. So you're going to watch, you want to watch their chest or lightly touch the chest and feel for movement. Count the number of breaths over a full minute to check the respiratory rate. Avoid openly showing the person you're counting, as that might cause him or her to alter the breathing rate. Same thing goes for the pulse. So people have a tendency to try to mess around with the pulse when they know you're taking it. So if you can distract them a little bit, that's best. Normal breathing rate for an adult is 12 to 20 breaths per minute. Also note the quality of the respirations. Breathing can be deep or shallow in volume. All right, so identify any unusual breathing sounds which might indicate a problem in the airway. All right, now you're going to look at the skin signs. That's how well the person is distributing blood to the body tissue. So tissue color indicates amount of blood circulating below the skin. Normal tissue color is pink. Paleness indicates blood loss or shock. A bluish color indicates a lack of oxygen. A red or flesh color indicates a serious underlying issue. So what do you think this guy's red? He's red or flesh in color. He's probably got something going on. Tissue color. Depending on the skin tone, it may be easier to look at the tissue color in the palms of the hands, fingernails, inside the lip or eye. With the back of your hand, feel for temperature and whether it's moist or dry. Okay, cold or very warm are both indications of a potential problem. Your skin should feel dry. If it's excessively sweaty, like in this picture here, there's something going on. If they're moist and sweaty without a reasonable explanation, like recent exertion, this can indicate a problem. Primarily, we want to be aware of shock. Okay, level responsive, alert and open. That's A. V. Responsive to verbal stimuli such as asking a question or saying the person's name aloud. P. Responsive to physical stimuli. And U. Unresponsive to any stimuli. Orientation. What's your name? Do you know where you are? Do you know what today's date is? Do you know what happened to you? You're going to check the pulse. Count the pulse beats for 15 seconds, multiply by 4. Note the strength and regularity. Check the respirations. Count the breaths for a full minute. Avoid showing the person what you're doing. Note the victim's breathing. Listen for any unusual breathing sounds. All right. So then we're checking for temperature and we're checking for moisture. All right, so considerations with this. A vital sign helps provide a sense of how well the person's body is doing and can help influence your decision to evacuate. Repeat taking the vital signs at regular intervals. Repeat them more frequently for serious people or serious illness or injury. Record initial and ongoing vital signs on a medical care report form. Always include the time they were taken. All right, sample history. Real easy, you guys should all know this. So sample stands for symptoms, allergies, medications, past medical history, last input and output, events leading up to the current situation. So to collect a sample history, ask a series of questions and record the person's answers. So if a person is unable to answer your questions, ask bystanders because they may know. Be careful to ask these questions calmly and without leading the person. Be considerate and respectful to get better answers to your questions. The person may be in significant pain, so be patient. All right. Symptoms. How do you feel? Where does it hurt? Can you describe the pain? That might be on a scale 1 to 10. How bad is the pain? Okay. What are you allergic to? That should be easy enough. But often enough, people resist telling you what they're allergic to. So, or they don't think that it's related to what's going on. Okay. So, and then also ask them to describe a past allergic reaction. So, I'm allergic to bees, and oh, my throat swells up something fierce and I got to go to the hospital right away. That's going to be a big flag for you, right? Okay, so medications. So, are you taking any medications? What are the medications for, and have you taken them as directed? Meaning, did you take more or less than you should have? Some people have a tendency to take it upon themselves to alter their medication plan. Additionally, a consideration should be recreational pharmaceuticals. So, or even drugs or even alcohol, right? So you can ask them if they've taken anything like that, and hopefully they will answer correctly or give you the right information. Ask them about their past medical history, but it really doesn't need to be the tonsils they had out when they were 8, 9 years old. It needs to be more pertinent medical history. So yeah, I had knee surgery like 8 weeks ago and I'm out here and I tweaked my knee again. That kind of thing. What medical problems do you have? What are you seeing a doctor for? What medical problems have you had in the past? Again, I don't really need to know that they had their tonsils out when they were 9. I do need to know if, for example, they have blood pressure medication that they have to take, or they have insulin that they have to take, or things are going to go sideways on us, and especially if they don't have that medication with them. What was the last input and output? What was the last thing that you had to eat or drink? When was that? Where was what you ate or drank out of the ordinary for you? Was it something different? When did you last urinate or defecate? Those tell you about how the internal organs are functioning. What was the color and physical makeup of it? So was your urine like brown, or was it clear and copious? What were the events that led up to the injury? Here, there's a picture of the guy touching the fire. So what were you doing just before it happened? That is critical, because you don't want to run into a situation where the guy says, "Oh, I just tripped over a log." Well, why did you trip over the log? Well, because I got lightheaded, 100 yards away from it, and then I was stumbling as I tripped over the log. All right, so here's just recapping the sample history. Ongoing assessment. You're gonna keep doing assessments at a regular interval. So you need to continually monitor them and assess, and keep asking them how they're feeling, and monitor treatment for effectiveness. Take vital signs repeatedly. Review, and that will actually help you too, because you'll be able to disguise what you're doing a little better when you are constantly doing it. Review your evacuation decision if conditions change. So, and those conditions could be environmental, like all of a sudden it started snowing, or it could be medically, that the injuries are getting worse, or the person needs their medication right away and they don't have it with them. So knowledge check. You and several others are hiking in the woods when you come upon an injured hiker and his friend. The hiker says he tripped over some roots, landing on his hands and knees not long before you arrived. A quick initial assessment shows there are no immediate life threats. What are the 3 techniques you will use to gather more information? So you're going to do a head-to-toe physical exam, measure the vital signs, and take a sample history. Okay, this is the scenario for that, and we are done with this. So now I'll have you go in and take a quiz, so that I know that you watched this and that you understood what we talked about. Thank you very much for watching. An initial assessment. Continue assessing the person using a focused or secondary assessment. Okay. A focused assessment allows you to systematically identify other injuries or medical conditions that need to be managed. Your goal is to find every problem that requires medical care. You may never begin a focused assessment if immediate life threats are present. So this is only after things are stable. Focused assessment includes 3 parts: hands-on physical exam, sample history, and vital signs. Okay, all of these assessments need to be done for every person. The order of doing them can vary.